Welcome everyone from the Community Paediatric team at Mid Cheshire Hospital Trust. This is our presentation about attention deficit hyperactivity disorder, otherwise known as ADHD. You are accessing this presentation as you have very probably had a child or young person in your care diagnosed with ADHD very recently. This presentation will briefly go over the human brain and in particular the ADHD brain. We'll discuss the chemicals within the brain and why the ADHD brain is slightly different. We will have a look at how ADHD affects people in their everyday life, how they may feel, how they may behave, how they may think, and how this impacts on their everyday activities, and particularly our children and young people within the education environment and in their friendship groups. We will look at some parenting approaches and strategies that will hopefully help and support you and your young person with ADHD. We will also talk you through ADHD medication management and our clinics, and hopefully put your mind at rest and answer your questions about ADHD medication and its possible benefits, side effects to our young people with ADHD. So what is ADHD? It's a well-recognised behavioural disorder that could result from a number of risk factors. ADHD tends to run in families, and there's an increased tendency of ADHD in relatives of children with ADHD. It is often inherited, and genetic factors are important in the cause for the majority of children with ADHD. We see a chemical imbalance in certain natural chemicals, otherwise known as chemical messengers, within the brain. Other ADHD causes can be brain injury, for example, illness or a traumatic birth. What we do need to remember is ADHD is most certainly not caused by poor parenting. ADHD has three core symptoms. These are inattention, hyperactivity and impulsivity. Inattention is difficulty in following instructions or completing tasks, short attention span and difficulty sticking to an activity, difficulty organising tasks and activities, easily distracted and forgetful, and often doesn't listen when spoken to. Hyperactivity is fidgeting and restless and constantly moves about as if driven by a motor and can't sit still in class. And they run around when it's inappropriate. Impulsiveness is children acting before thinking. This behaviour can sometimes be seen as reckless. They interrupt people, they blurt out answers without waiting for the question to be finished, and they can have difficulty in waiting or taking their turn, and particularly queuing in a shop. It's important to recognise that not all children with ADHD have all the symptoms. There are 3 different types of ADHD according to the assessment classification criteria. There is the inattentive type, which is a term used to describe children who mainly have problems with concentration and their attention span, but are not usually impulsive or overactive. There's the hyperactive impulsive type, describes children who predominantly have problems with overactive and impulsive behaviour. And then there's the combined type. As the name suggests, the combined symptoms from the ADHD, hyperactive, impulsive and inattention. So let's consider the human brain. The frontal lobe of the brain acts as the executive functions. Its role is to process our thoughts, planning and organising ahead, waiting our turn, understanding social situations, organising our actions, and provides us with the ability to focus and pay attention. It's the frontal part of the brain that has the responsibility for recycling of messages to enable us to make good choices to be organised and to be patient. And it's that part of the brain in people with ADHD who have a reduced capacity to recycle the chemical messengers to make measured decisions. Our brain has billions of nerve cells whose job it is to move messages from one to another via chemicals, and those chemicals are called dopamine and noradrenaline. So if we consider those chemicals to be like postmen, delivering letters from one brain cell to another brain cell to another brain cell. And those brain cells are connected by a bridge known as a synapse, and it's across those bridges that these chemical messengers send the messages from our brain to our body. And we need sufficient amount of these chemical messengers or postmen to move those messages from one nerve cell to another. ADHD brains appear to lack sufficient amounts of these chemicals. Therefore, the messages can be sent very quickly and aren't recycled. So we see the hyperactive, impulsive and inattentive type behaviours. Let's consider how ADHD affects people. This is obviously very personal to each individual, depending upon the type of ADHD they have, their surrounding and their environment. Their focus and concentration could be affected. They may struggle to sustain attention and focus. For example, within a classroom environment, they may struggle to focus on the teacher and the lesson and be easily distracted by what's going on outside the window or other pupils in the class. And then we see elements of their learning could be affected, so they're not reaching their potential. At home, you may notice they are unable to follow instructions and follow a task through. For example, at home, you may send them upstairs to get you something, and then they get distracted and they're playing and they forget why they went upstairs in the first place. Organising and prioritising workload may be poor. For example, they may not be able to pack their school bag with the right equipment for the right day. They may leave homework till the last minute and then panic. They mislay and lose their equipment, their clothes, their coats, their PE kits. They're probably known as the disorganised one and the messy one that leaves things lying around. They may struggle to regulate their alertness and their focus and their concentration, so they may be quite alert and bright, and then they might go off into a dream world and be not focusing on what's been discussed around them or the instructions given. They may be in a dream world. Remembering instructions, following instructions. You may be asked them to go and fetch something. By the time they get back to you, they've forgotten what you asked them. A strategy to manage this is to break instructions down into one instruction at a time. They're unable to remember a list of instructions and do them in the right order. Managing and controlling their impulsivity. They may impulsively shout out in class, impulsively say something, do something, touch something, run up a tree, cross a road, shout out something to somebody that can appear rude or aggressive when it doesn't mean to be. It's just their brain working very quickly and they want to tell you what they've observed. Hyperactive behaviour, which is that bouncing behaviour, that constantly on the go. They seem to be wound up like a motorised toy. They never seem to stop. Their energy seems to be never ending. They may struggle managing frustration and self-control. So they may be observed to get very irritated by other people's actions or lack of actions. They may be impatient or irritable and seen to shout out, particularly in the classroom environment. And this is unfortunately the behaviours that can get them into trouble. Emotions and feelings within themselves, they may struggle to verbalise them. They may be angry and sad and frustrated within themselves because of the ADHD behaviours and how other people perceive them. So they can get quite upset or angry at times. And time blindness. That isn't not being able to tell the time. They may be able to tell the time very well. But this refers to their struggle to understand the process of time. So you may say to them, we are going on holiday tomorrow. And then they're constantly saying, are we going on holiday? When are we going? When are we going? They struggle with the concept of understanding passage of time and how to be patient. Equally, it may be that they don't understand how quickly time goes, so that can be seen sometimes with the pressure of homework and assignment work, that they think, oh, well, I've got 2 weeks, that's a long time, but actually they meet the deadline the night before and then there's a panic that ensues at home because they really need you to help them to do that piece of homework. You also may see a child who is quite sad and has poor self-esteem, self-belief, self-confidence. This may not be the case, but remember, our children and young people with ADHD have maybe had a difficult journey. They've been told that they're naughty and they're difficult and they've struggled with their friendship groups. So their self-esteem may be quite low. And if we have poor self-esteem, then everyday life can be quite difficult. So it's important that we use positive words and we try and improve their self-esteem and self-belief. Young people with ADHD may present with other problems. This is variable, not everybody's the same, but with our younger children you may observe that they're going on and on about things. They may have a particular interest at that moment in time and it takes every part of their life, so they could constantly be talking about, for example, it might be Minecraft, it might be a particular song, it might be a film, it might be a cartoon or a particular computer game. They can be incessant. Badgering and nagging to get their own way, this is a strategy they may have learnt and they will go on and on and on, can I have, can I go? And they have tremendous strength and resilience and energy. And they're younger than you, so they can do this for long periods of time. And please don't let this weigh you down. Remember that you need to go back to your behaviour management strategies, and if you want to stop them going on about something or badgering and nagging, then use your stop behaviour management techniques. Finding it hard to accept no for an answer, they again will badger and nag, and if they want something they are just possessed by it, and they could almost have meltdowns and tantrums because they want something very badly. It's very important to them. And they want everything now. They can be very insistent and can work very hard at getting everything now. They may be developmentally behind their peers. This doesn't mean that they're educationally behind their peers or they have low IQ. It may be that their executive functioning to make decisions about things may be delayed. And also we do find sometimes they developmentally can be behind their peers, so they may struggle to learn new tasks and it can take them longer to learn new tasks. So for example, tying shoelaces might be more of a challenge, and so don't expect your average child, for example, who's going up to high school and needs to be organised, follow a map and follow a timetable, to be the same as their peers. They may be struggling, and we wouldn't expect a 9-year-old to do some of the things that an 12-year-old can do. Poor organisational skills, poor time management, losing things, delaying tasks. They'll delay tasks that they've struggled with and they don't like, and they can't always achieve what they wish to achieve. They will lose things. They may come out of school without their pencil cases, their coats, their lunch boxes, their water bottles. It's very common. And poor self-esteem. Not all children have this, but if you have everyday life is quite difficult for you because you lose things and you can't quite function as your friends and peers do, then that can affect how you think and feel about yourself. That's the end of that, Mitchell. So if you could slot that in between slide 7, how it affects people, and before we get to the comorbidities. Thank you. With ADHD, you may also see other behaviours we need to be aware of. For example, dyslexia, which is the difficulty with writing and reading. If you do feel your child may be dyslexic, then this is something you need to discuss further with your school, and they may be able to do assessments for this. Sometimes we also see dyspraxia, which is where a child is clumsy. They may struggle for example with things like riding a bike, hopping, skipping, and generally lack coordination. They may also have difficulties with their fine motor coordination, which is the holding a pencil, handwriting, and the fine motor. So, for example, threading a bead onto a thread. They may be a little clumsy with things like that. Oppositional defiant disorder or conduct disorder. Conduct disorder is characterised by the child or young person displaying repeated and persistent acts of antisocial, aggressive and defiant or challenging behaviour. Tics or Tourette's. These are when they may verbalise a noise or a sound, or it might be a twitch of usually in the face, around the neck, the eye, the mouth. Obsessive compulsive disorder. OCD is a type of anxiety disorder where a person has trouble with frequent obsessions and or compulsions that can cause some distress. Obsessions can be described as frequent and uncontrollable thoughts and images. Examples may be contamination, so they worry about contamination with food, dirt and germs. Aggression, fears of harming others by loss of control. Hoarding junk and unable to get rid of it. And compulsions may be repeated washing, cleaning, checking, arranging items, and repeating certain things. Autistic spectrum disorder or condition is a developmental disorder of a child's ability to interact socially and communicate socially. Some of our children with ADHD may have features associated with autism spectrum disorder, in particular with difficulties understanding and adhering to the rules of social interaction. It is increasingly recognised, however, that both conditions are present in children who may initially only have been diagnosed with either ADHD or autism. The national guidance that we follow for the diagnosis of ADHD is from the National Institute of Clinical Excellence. They are guidance that provides evidence-based assessment and treatment for many conditions, including ADHD. They advise that the first line of intervention and management of ADHD is behaviour management. The second line of intervention available is medication management alongside behaviour management strategies. So behaviour management is important for all of us. We all live by a set of rules and behaviour expectations. With ADHD, it's maybe even more important that we are clear, concise, and have a set of expectations for our children and young people with ADHD. The first piece of advice would be structure, to keep the home as calm and happy as possible. ADHD children can be easily distracted by almost everything, so it's important to try and maintain a routine within the home. Consistency. Keep the information, the expectations as clear as you can. Break down tasks. Use a timer. Don't give too many tasks at once. Be very clear about what you want, what you expect, and the time span in which it's to happen. Don't throw your child a whole list of expectations and say go and do them. Break them down into very clear, manageable, bite-sized pieces with one instruction at a time that they can complete and then return to you for the next instruction. Routines. They can provide a regular sequence of events. If you can, we can't all have a set routine all the time. But for example, think about those stressful points in your life. Quite often it's the breakfast time, the getting ready for school, getting up and out time. It may be the evening meal time, it might be the homework time in the early evening, and then it may be the bedtime. All of those things can be managed by providing a consistent routine around timings, what's expected, to avoid those heightened emotions and those events where things can get a bit loud, you can start to shout, you can get a bit angry, and then the whole house has heightened anxiety and it can lead to confrontation within the home. For some of our families and young people, using a picture-based diary with times can be quite helpful. so they know what to expect at which time, so which time to put their shoes on, which time to clean their teeth, which time to be ready by the door with their coat on. In the mornings, all of those strategies can be helpful. Family rules, household rules and expectations need to be very clear, concise, so everybody understands them and everybody follows them. What I would advise you to do is to ensure that they are consistent, that you stick to them so you know what is expected. And it's very important that your young people and children know what to expect. Don't move and change the rules. It gets very confusing. If you can imagine it yourself in your workplace, if you have managers who constantly change the rules and what you should be doing and how you should be doing it and when you should be doing it, it's very confusing and it's quite frustrating. So think about that in the home environment. Try and be clear and concise about the household rules and expectations and make sure everybody knows what they are. And think about the rules that you do make. Think about the things that are worth having rules about. So maybe let some of the petty things go that actually you're not managing to change by any sort of behaviour strategy. So think about household rules and the rules that you think are important to you and your household. Try to forget the petty small things and work on the bigger things, and the things will grow and develop as your children get older. And one of the really important things is to build a rapport and build your relationship with your children and young people. They are growing and developing, they're constantly changing, they'll push the boundaries, they can be funny, they can be witty, and they're just lovely to have. And I know that at times your relationship may be challenged, but build on that, work on it. Nobody ever said it was going to be easy being a parent. So to summarise behaviour management, there's two really important things you think about. Straight thinking, and remember they are not little adults. These are children. You're the parents in the home, you're the adult, you're in charge, you make the rules, as long as they're reasonable rules. And always remember that they're not adults. We can be guilty of what we call the shouldy behaviour, which is they should be able to do, they should be able to do this, go there, behave like this. But actually our children with ADHD tend to take longer to learn new skills, and because of their impulsive, inattentive behaviours, their behaviours can be more challenging. So be clear, be concise, be definitive about what you want them to do and to be consistent with that, and they'll be happier knowing what the clear rules within the household are. Our service has created some parenting and behaviour management specific sessions that are available on a PowerPoint that you could access as well. If you want to be able to access those and you don't know how to get to them, do give one of these telephone numbers a ring and we'll be able to sort that out for you. Our ADHD children have real positives, and it's important we build on those. And some of them may have had a difficult journey through their education, with their ADHD getting in the way of their friendships and their education. So we need to really get them going with their confidence. So as parents, it's our job to work on that with wonderful words. What do we mean by that? That means be really positive, pick on the positives, even if they're small ones. Take time to listen to your child, acknowledge what they say, try and keep eye contact, keep the conversation going, and let them have an opinion. Use lots of encouragement, be specific. And the one that they do like to see is that you're watching them, you're listening to them, and you're giving them praise as well. If they're not doing something quite right, try and guide them, don't criticise. Have some respect and trust for them. And then eventually the relationship, if it has been challenged, will hopefully improve for you. It's really important that we acknowledge the strengths and qualities that we often see in our young people with ADHD. They are tremendously warm-hearted, sensitive and caring. They're imaginative, they're creative. They'd be really good at art or music or drama. They frequently have tremendous sticking power. They can be persistent and resilient and resourceful. They're good in a crisis. If there's ever an incident anywhere, they're the first ones there, helping and supportive. And you know what? They're always willing to try something new. They do have that tremendous confidence and ability to think outside that box. Yes, I know some of this stuff sometimes can be the stuff that gets them into trouble at school or outside. They may have accidents and injuries and find themselves in A&E with cuts and bruises and broken bones. But they're real experimenters and quite confident people. And so we need to embrace that. These are some of the qualities that will get them through their school, their education, into the workplace, in their adult life. And they're usually great fun to be around. So it's almost a superpower. So embrace that. So we've talked about ADHD, what it is, what's happening in the brain. We've talked about some of the behaviours you may see, some of the things you could do to support it, and touched on behaviour management. So we'll have a conversation now about ADHD and medication. ADHD does not need to be medicated, but it is there to be used as part of the management strategy for ADHD in our children and can be really successful. What can medication do? It helps control those 3 core symptoms of ADHD, which, as you remember at the beginning, we said that were inattention, hyperactivity and impulsivity. The medication can help to bridge those gaps. You remember those bridges in the brain, the postman. So it sort of creates some new postmen, if you like. So it supports them to pay attention, to concentrate and remember things. It can reduce that impulsivity and hyperactivity. They're a little more calmer and more in control. They think more clearly because the brain messages aren't running quite as quickly. And as a result, it can improve relationships with parents, with teachers, with friends, and they make wiser choices. So you will see a quieter version of the child you've always had. It does not alter the brain permanently. It's just a chemical that's been replaced within the brain to enable those postman messages, to help those messages across the synapses to be a little bit more effective. All medication potentially comes with side effects. They are generally not of any great concern and mostly can be managed. But it's really important that if you do decide to go down the medication route for ADHD for your child, that will be supported by our service and in discussion with yourselves. With medication, as ever, it's always really important that you read the information leaflet contained within the packaging. There will be some side effects, as I've mentioned, but frequently not of a huge concern, and they can usually be minimised and managed. The benefits of the medication will frequently outweigh the side effects, and we will discuss that very closely with you in clinic. We don't want to do anybody any harm. We want to make sure this is minimising the side effects while getting really good benefits. But always be rest assured, we will only ever support with medication. It's very much your choice, not our choice, and it's very much a shared decision. ADHD medication, like all medication, has potential side effects. Some of the more common ones that we do see initially is the complaint of a slight headache or a slight nausea. We do find this goes away very quickly after a few days. If required, then the paracetamol can be taken at the required doses for just a short period, and we usually find the headache and nausea does subside. Very commonly, reduced appetite, particularly at lunchtime on ADHD medication. However, once the medication has worn off in the afternoon, the appetite usually returns in the evening and the young person eats very well. We do keep a close eye on weight and height growth, and we'll have a discussion with you if you feel there's any concerns about the growth patterns. So initially there may be some slight weight loss when we're first trialling the medication and you're getting used to the slightly altered eating pattern of your child, but we monitor that and support you with that in clinic. Some less common side effects that we do occasionally see will be a child's blood pressure may be slightly raised and the heart rate may be slightly raised. This is very uncommon, but we do monitor this in clinic very closely at regular intervals. And if we find this is a problem, then we have alternative medications. We would maybe change the preparation to stop this being a side effect of concern. As already mentioned, slight weight loss can be seen, particularly if the child's appetite is affected, and we will monitor that very closely in clinic. And we will occasionally say to you, if we feel this is an issue, to maybe have weekends off medication to allow their appetite to return. Sleep may be affected. We do sometimes see that sleep can improve on the ADHD medication. But again, we'll discuss that in clinic. It's very important, as you know, children have a good night's sleep, so it is something we just monitor within the clinic environments. Very rarely we do have some children who experience some hair loss with the ADHD medication, so it's really important that you do inform us of that if you see that that is an issue. Increased anger and aggression can be seen, or emotional upset may be seen on the medication. At the end of the day, it is a medication that is acting on the brain. So it's important that you tell us about your child's mood and if you feel the medication is making anger and aggression worse. They may be a little bit more emotional as well, particularly in the early days when we are getting the medication to the right doses and levels for them. So again, we monitor that very closely within the clinic. So ADHD medication, I'm not expecting you to remember the names of these, the doses of these, because there are a few of them. Most of them fall into the stimulant medication preparations, and they have a base medication of methylphenidate, and we have methylphenidate preparations that last 4 hours, 8 hours and 12 hours. The medication that your child may trial and then ultimately commence on long term is very much dependent upon their need, what our consultants feel would be best for them, and then ultimately when they've had a trial of medication we can manipulate the dose and the preparation of medication to best suit their needs whilst we minimise the side effects. So names that you will probably hear are methylphenidate, and that blocks the recycling of dopamine. If you remember, that was one of the brain chemicals in the frontal lobe of the brain we discussed back in slide 2, I think. And we have 8-hour preparations of that, which are Equisim and Medicanet. And they have slightly differing release times. So one medication may suit other people better than others, but that's something we will go through at the time. So 12-hour preparations of methylphenidate are available also. They can be really helpful for maybe our older young people who need some management within the evening if they've got homework or evening activities. And some young people just metabolise the medication very quickly, so it wears off. So we go for longer hour preparation for them. Unfortunately, ADHD medication is not an exact science for everybody. Everybody requires different medication types, different doses, different timings, and just because a medication suits one child doesn't mean it will suit and work for another one. So it's generally a sort of a little play around with the dose and the type of medication to suit them the best. Another stimulant medication we use is something called Elvance or lisdexamfetamine. That's a longer acting medication up to 13 hours. And that is used if the other methylphenidate-based medications don't prove effective. We also have what we call non-stimulant medication. So they act on the noradrenaline. And these are longer-acting medications. These have a 24-hour cover, so you have to take this medication every day. You can't have days off. It takes a number of weeks for the benefits to be seen in your child, so you do need to be very patient with this one. But this can be very successful in some of our patients who don't tolerate stimulant medication, and it can be really, really helpful. So that is available if we feel the other medications haven't worked. We also have now something called guanfacine, which is a non-stimulant, and that is used if we haven't had success with methylphenidate or Strattera. The guanfacine is available. Please do be aware, if you choose to go down the medication route, when you collect your child's prescription from the pharmacist, they may well ask you for identification, because this is a controlled drug and it needs to be carefully checked and monitored and treated very carefully. So that's a whistle-stop tour of medication and what's available. So medication-wise, very much your choice. Many of our young people take medication with tremendous benefits. You don't have to choose it, Many people manage without it. And it is a shared decision between you, your child, our service, and we will offer you support and advice and discuss through your concerns and obviously hopefully see some benefits. So you choose to go down the medication route. What can you expect? You'll be initially offered an appointment with one of our consultants who will offer a trial of medication. They'll check your child is fit and healthy and able to take the medication. They'll ask about family history and they will offer you a trial of medication. You'll be given a green prescription that you take to a pharmacy of your own choice to get dispensed. It doesn't cost anything. Do remember it is a controlled drug, so please make sure it's locked away safely at home and you supervise its administration. Our ADHD children don't manage to manage their own medication until they're a little older, so please make sure it is taken. We always start with a low dose to monitor for side effects first. So please don't expect a miracle in the first week. You may come back to our clinic when we do the review of that trial of medication and say, oh, this hasn't been really helpful at all. But as long as we can see there are no side effects, that's when we can start to increase the dose in those clinics to get them to a level that are really helpful for you and your child or young person. So our clinics, what do you expect? You'll be seen regularly. We check their height, their weight, their blood pressure and their heart rate. If they don't like having their blood pressure done, they'll very soon get used to it and we make a little game of it. We ask you to please arrive on time. Our clinics are very busy and we don't have any wiggle room if people are late. We know it can't be helped sometimes, but we'd really be grateful if you could come on time. If you do have any school feedback, that would be really helpful because our children are at school most of the time taking their medication and they maybe see most benefits from it. So please do get some school feedback if you can. An email is fine if you can read off that when you get there. That's brilliant. You'll have regular reviews in our clinic. If we change or alter medication, we may see you more often. Once we're in a settled, happy place and we're not seeing side effects, we can stretch the reviews to anything between 3 and 6 months. We have what we call a shared care agreement in place with local GPs. So you'll come to our clinics, we will monitor, as we've just said, height and weight and blood pressure and have a conversation. And if we're in a settled place with medication, your GPs will pick up doing the prescriptions for you for your convenience. So you can order repeat prescriptions from them until we review you again. If you can't make your appointment that is sent to you, please do cancel it and rearrange. It's not a problem doing that. We can't offer everybody, obviously, an appointment out of school time. But if you please do attend on time and cancel and rearrange if you need to. Hospital policy is that if you fail to attend 2 consecutive appointments, we are able to discharge and we would ask your GP not to prescribe any further. And that's because this medication has to be monitored and we can't ask your GP to continue to prescribe if we've not monitored your child's height and weight and blood pressure. So please do attend appointments. As already mentioned, you may be asked for identification when you go to collect the prescription. Keep it locked away, supervise its taking, and read the patient information leaflet within the medication. Please don't be frightened by that because it talks about a lot of potential side effects and can be quite scary. But please don't be put off by that. We'll be monitoring those very carefully in clinic. If we do change your child's medication to a different preparation, could you please ensure you return unused medication to your local pharmacy to be destroyed of and disposed of safely? You don't want it hanging around in the cupboards at home. So, ADHD medication is very much your choice. But we like this slide. If your child needs glasses, you take them to an optician and they wear them. We absolutely understand that ADHD medication might be quite a scary choice for many parents. But, you're not going to know until you try it. And if your child is having a difficult time at school and they're not reaching their potential with their learning, it might be worth having a go with it. It can always be stopped. If you and your child don't like it or is of no benefit, it can be stopped, but we won't know till we try. So discuss with us your concerns and we'll support you through that journey. So what happens now? You've listened to me talk a lot. You'll now be offered a review with one of our doctors to discuss commencing ADHD medication, if that's what you want. If you don't want to commence medication, you don't need to come to that review appointment at all. The ADHD diagnosis will stand. And at any point in the future, if you do wish to go on to ADHD medication trial with your child up to the age of 19, then that can be done. So that's not a problem. We are a 9 to 5 Monday to Friday service, so if you do have any concerns or worries, if your child's on medication, we're not available at weekends. You would need to seek help from your GP or some other out-of-hours service, but Monday to Friday, 9 to 5. If you do have worries or concerns, there's our telephone number, that's our secretaries. Please do give us a ring. They'll take a message and one of us will get back to you as soon as we can. We've reached the end. I hope that's been helpful and informative.